The options I was given for treatment was basically watch and wait or surgery.
Whilst it was growing slowly, it would just continue to grow.
As I sit here today, ostensibly I have no problems. My treatment, once I'd had the diagnosis of paraganglioma, was coordinated at the Queen Elizabeth in Birmingham. I was placed on alpha blockers to counter the effects of the high levels of noradrenaline that were being produced by my tumour. Some beta blockers as well, a particular type of beta blocker to help with the arrhythmia. But ultimately the only treatment that was available, there wasn't no other treatment other than surgery and then excising the tumour. I had some trepidation about it, exactly how it was going to be, how it would turn out, whether the tumour could be completely removed. But went in the hospital for a couple of days before, kept in, taken down early in the morning, and then woke up some hours later with Rebecca standing there talking to me and being told that the tumour had been completely removed. That surgery had gone extremely well. Fortunately, it turned out histology showed that the tumour was non-cancerous and there was no indication of spread. I was in ITU for about 3 days and they were managing some of my hormone levels whilst in ITU. But even at that stage, I felt better. Apart from having a great big wound in my chest where I'd been opened up to have it removed, but I felt almost immediately better once I come around. And over the next few days, everything was fine. My blood pressure had dropped down to normal levels. My heart rate was low for the first time in years and normal. My ECG was good. My cardiac output was good. And as I sit here today, ostensibly I have no problems. I'm no longer on any medication. I consider myself very, very fortunate.
The options I was given for treatment for this tumour was basically watch and wait or surgery. When I asked about surgery, there was a whole list of risks that come with it, especially because the tumour was on the carotid artery. And those risks were amplified by the fact that there are a lot of delicate structures in the neck, the vagal nerve, your esophagus, your windpipe. Other risks included stroke and excessive blood loss. So these risks were quite scary. And I had to contemplate them over quite a lengthy time. I didn't rush into it by any means, but even knowing all of that, wondering every day if that lump was, how big is it growing, is it going to metastasise? That was an even greater risk for me. So I weighed up the options and opted for surgery. It went very, very well. I had a really swollen neck, which would obviously be expected. And the good news that they gave me was that they got the tumour out successfully. They hadn't had to cut any nerves, but they had to stretch them. So I had a lot of numbness. I had a little bit of facial paralysis to start off with, and it was a little bit difficult to swallow at first, but I was absolutely relieved that actually it was out. I still knew I'd made the right decision, and if any of this was permanent, I was happy, I was fine to live with that. But I knew that over the coming months that a lot of that would heal anyway. which it has done, and I'm nearly 1 year post-op, and even the scar is difficult to see now, and the only thing I've got left is a little bit of numbness still. So I feel really well.
So the treatment option presented to me was to have the tumour surgically removed. It really was the only option presented to me. I was told I could leave it if I wanted to, but I was strongly advised against that. Whilst it was growing slowly, it would just continue to grow, and its location would just cause more nerve damage in my neck and eventually get up into my brain. And the reading that I'd done supported that surgery was the only way to sort of cure the tumour. One of the main things we talked about was nerve damage. The location my tumour was on my neck, there's lots of nerves around which operate different parts of your body. And I was told that just with where it was, it'd be quite difficult to get in there. And as a result, I might suffer some nerve damage. I'd never had surgery before, so I was quite anxious about going for surgery. I was even worried about anaesthetic, but I accepted that that was my only way to get this out, and actually the headaches were that bad that it seemed like a good option. The day I went in for my surgery, I was first on the list, and so I was straight in. 6 hours later, I came out, and the first thing we were told was it was a success and they got the tumour out. I was in the hospital for 2 weeks, and at the point I left hospital, I could eat about a teaspoon of yoghurt or smooth food. I went to speech and language therapy for about a year, and I also had an injection into my vocal cord of a filler so that I could make more sound. So that year of recovery on my vocal cords really helped me get my sound back. Things were getting back to more normal, what I call my new normal. So whilst my tumour is out, I am at lifelong risk of developing more, but I'm really confident that my follow-up is monitoring that, and actually because they're slow growing, it means that anything should be picked up early, and that's really important because the earlier something's found, the easier it could be treated.
I don't feel stressed about it at all. You know, I'm at ease with it now. It's there. It's a bit of bad luck, you could argue, but also I've been very lucky in the treatment that I've received.
I am aware of the fact that I have an enhanced risk of developing tumours again in the future. Although, as was explained to me at the time, that knowledge is developing year by year and case by case. Statistically speaking, as I sit here today, I could be in the process of developing another tumour, or it could be another 30 years. Nobody knows. But certainly for the moment, all is good. So live life for the day and see what the future holds.